Hi everybody, I am going to talk about the perspectives of holistic family health. The sustenance of families depends on their happiness, and the happiness of families is based on their holistic health status. As most of us believe, health is wealth, and with this belief, the health consciousness of people has increased, so their investment in their health is also on the rise. Being healthy is understood in terms of a person's sense of well-being at the physical, mental, social and spiritual realm. Holistic health indicates an interacting function of economic, biosocial and psychosocial factors. Families are the most conducive place for creating a healthy generation of persons, and therefore the need for holistic health of the family has to be understood by all. At the end of this talk, you will understand the importance and need for holistic health, know the different aspects of holistic health and learn the indicators of holistic health. Let me describe the meaning of holistic health. Health is considered as wealth, and the concept of health has changed over a period of time. Current views of health and illness recognize health as more than the absence of disease. There has been a paradigm shift from mere physical fitness to the well-being of mind, body and soul. Now, health is referred to a composite understanding of the integrity of mind, body and spirit. Health is a relative state in which an individual is able to function well physically, mentally, socially and spiritually in order to express his or her unique potentialities to the optimum level within the environment in which he or she is living. In the words of René Thubaud, health is primarily a measure of each person's ability to do and become what he wants to become. The preamble to the Constitution of the World Health Organization defines health as a state of complete physical, mental and social well-being. However, the concept has changed since 1948 and holistic health concept has included spiritual and emotional well-being. Therefore, mind and soul, in other words, mind and spirit, stand as an important component in holistic health. According to the biopsychosocial model, holistic health can also be seen as the overall wellness on all levels of your being, physical, emotional, mental and spiritual. It encompasses the health of a person's entire being and extends to everyone and everything that affects him or her in any way. Therefore, the acceptance of integrity of mind, body and spirit as a key factor in measuring the health status of individuals becomes customary. Effective interventions by families in the preventive or curative process are crucial as they are responsible for the birth, growth and progress of individuals. Hence, holistic family health is significant in deciding the health status of the nation. Let me explain the need for holistic health. Survival of humanity depends on the holistic health status. We have witnessed the mass mortality which takes place due to distraction. Sickness, epidemics and mental illness of individuals such as hatred, racism and fundamentalism have caused the annihilation of humankind in many countries in the past, and this trend continues to exist even today. Violence, war, epidemics, starvation and famine are the outcome of the lack of holistic health. The mindset of perpetuators of negativity is lopsided and they inject or continue to spread such epidemics of hatred to the entire nation, it will result in the downfall of the nation and civilizations. Development of individuals or nations takes place in the way the thinking process takes place. If the thinking pattern is positive, it will yield positive outcomes. For positive thinking, one needs to have a conducive atmosphere. Here, the role of the government has a crucial role in creating a conducive atmosphere. The policies of the government would help to make choices for development. For example, the scheme of the government providing iron and folic acid supplements to adolescent girls to reduce anemia among girls and women makes way for development. Likewise, the provision of nutritional meals for school children by some of the state governments helps the overall growth of children and enhances their physical and mental development. The construction of toilets and immunization against epidemics are some of the preventive measures that protect the health of the citizens, particularly children and women. Taking care of holistic health is important to protect and safeguard nations. Holistic health should be seen as an investment in a country. Each country is measured in terms of the Human Development Index. It is a summary measure for assessing long-term progress in three basic dimensions of human development: a long and healthy life, access to knowledge, and a decent standard of living. The progress is based on the status of the human resource of a country. Healthy human resources produce a progressive nation in terms of happiness, peace, knowledge, and practice of democratic governance, in addition to human, natural, and financial resources. When we review our country, it has nearly 17% of the world's population and a large proportion of the world's poor with poor health indicators. The Indian health system is administered by the Health and Family Welfare Ministry, which supervises a state-funded, subsidized, universal health care system. Starting from the primary level up, it provides curative and preventive care through a referral-based system. Although in sheer numbers, the presence of the public sector is huge, it falls below the world standard of ratio of manpower and hospital beds. Huge cost of treatment makes health care inaccessible and expensive to the poor. Therefore, it is imperative for us to look at the link between mind, body, and spirit of the individuals and families, and to create an environment for holistic well-being of the nation through sustainable and affordable health care. We acknowledge these three dimensions of health, namely body, mind, and spirit. Let me explain the importance of each of these dimensions of health. Regarding physical health, it depends on a number of factors like the immunity level of individuals, genome factors, lifestyle, untoward incidents like disaster and accidents, access to nutrients, and healthcare measures of the state. Children or persons living in poor socio-economic backgrounds report common ailments and epidemics as the environment they live is disease prone and they do not have the immunity to fight the disease due to poor nutrition. The families and the state are concerned with the health of the citizens. Health is an indicator of development. The state has initiated various preventive measures to check the health status, such as mortality of children and mothers, and to arrest the breakout of epidemics. Likewise, it promotes child and adolescent health through clinical and nutritional inputs. Social case workers should be able to support the families in identifying the ailments and referring them for treatment. They should also be in a position to identify the reasons of poor health status and help the families to lobby collectively to get their due share of health care. With reference to mental health, it is often neglected at a family level due to ignorance, fear of stigma, lack of faith in the recovery process, and also due to financial crunch. The persons with mental illness are hidden by the families, or the families put them in care centers. Lack of awareness about the type of disease and anxiety about recovery make the families abandon mentally ill patients. Social case workers can create awareness among families and communities about the types of mental disorder. People need to develop their understanding and knowledge about mental health. According to the World Health Organization, mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her family and society. Depression, psychosis, epilepsy, somatization, bipolar disorder, schizophrenia, and substance abuse are identified as mental illnesses. Mental health is affected by a number of reasons which include biological, psychological, and environmental factors. Poor nutritional intake, disaster, or accidents are also reasons for mental illness. Mental illness leads to suicides and abuse of women and children. The National Commission on Macroeconomics and Health report in 2005 stated that nearly 60 to 70 million people in India have some kind of mental illness. The Commission also estimated that there was a 70 to 80% treatment gap for mental disorders. One could observe the increase of the population with mental illnesses in all age groups. This data is again a warning about the status of mental health in India, and it indicates the need for comprehensive mental health policies. As there is an inadequacy of studies on mental health, there is a general agreement about the increase of patients with a mental disease inferred from the crime records, increasing substance abuse, and the alarming suicidal rates. The approach to mental illness is also changing as a recent mental health care bill introduced in 2013 in the Rajya Sabha emphasizes on the rights of persons with mental illnesses. Let me mention the barriers which affect the availability of mental health services. World Health Organization also indicates 5 key barriers that come in the way of increased availability of mental health services. Obviously, these 5 barriers need to be overcome in order to increase the availability of mental health services. These barriers are the absence of mental health from the public health agenda and the implications for funding, the current organization of mental health services, lack of integration within primary care, inadequate human resources for mental health, and lack of public mental health leadership. The Health for All Action Plan recognizes the essential role of mental health in achieving health for all people. It aims to achieve equity through universal health coverage and stresses the importance of preventive mental health action. In 2013, on Human Rights Day, As part of its Quality Rights Initiative, World Health Organization launched Mind Bank. This new online platform brings together key international resources and national policies, strategies, laws and service standards for mental health, substance abuse, general health, disability, human rights and development. Mind Bank will facilitate debate, dialogue, advocacy and research in order to promote national reform in line with international human rights and the best practice standards. The global perspective on mental health has created an impact on the outlook on the rights of mentally ill patients, and therefore the case workers can facilitate the changing of perspectives of communities through creation of awareness and help the families identify the illness, refer them for appropriate therapeutic intervention. Let me tell you about social health or community health. Social health or community health also depends on mental health. A person with a sound mind can build good relationships. The social health of a society is important for a nation, and it is based on the relationships within the society and among the nations. It also depends on the socio-economic and political well-being of the society. The basic attitudes and behavior of the citizens towards their fellow beings reflect the social health. It can make either positive or negative impact. The seeds for social health are the values and attitudes nurtured through the families. Therefore, promoting altruistic attitudes and noble values in families reflects the existence of good social health. For example, if the families inculcate casteist values, the members may develop hatred and discrimination as a practice which produces negative energy and promotes a casteist society. The casteist and racist behavior brings in harm and destruction to society. So, it is imperative for caseworker to instill good values and even challenge the elements which are harmful to the society, and also to educate the communities about their social responsibilities in order to develop tolerance, harmony and peace in the society. They can educate the people with the examples of families and communities who have rendered support and care for victims during riots. Positive outlook on communal harmony, religious and racial tolerance and equality should be reinforced. The other area of social or community health is the economic well-being of the community. Therefore, looking at the means for economic stability of the community is important. Social caseworker can identify, mobilize and link opportunities for the economic improvement of the community. Families can be identified for economic improvement. Their economic capacity can be enhanced through skill upgradation and resource mobilization. Let me mention about the spiritual health. Spirituality is the most essential component for human health. It is believed that if a person is spiritual, the chances of having evil thoughts are less, and therefore being spiritual is not only advantageous for individuals, but it is also for the society that is being saved from evil and destruction. The rationale and perspectives of social justice are based on the spiritual orientation of the individuals. When we say the term spiritual, it is not necessarily linked with any religion or rituals. It is a relatedness of the inner self of the human being to the outside world. A spiritual idea or the higher power one relates with can be goodness, love, or creative power. Persons practicing spirituality would like to see the good of everyone in the society and will be able to give up personal gains for social harmony and peace to the nation. It is a spirituality in every one of us that makes us forget and forgive and teaches us to be tolerant and to care for nature and our fellow beings. Religious practices and moral stories teach the society to groom individuals as spiritual humans, fruitful to the society. Ennobling ideas have given rise to healthy ideals which have led to a practical strategy for health for all that aims at attaining a goal that has both a material and non-material component. The spiritual dimension plays a great role in motivating people's achievement in all aspects of life. Social case workers can help families to follow the human values in their respective religions and to inculcate in their children the great values from the lives of heroes of various religions. Let me outline the indicators of holistic health. Social case workers can use various health related indicators to assess the health status of the families. There are a number of health related indicators. First, access and coverage of health services such as antenatal care, incidence of infant mortality, and environmental conditions which include improved drinking water sources, clean air, personal hygiene, and sanitation facilities. Apart from the above, social case workers can also explore the gross national happiness concept, which implies the four pillars, namely good governance, sustainable socio-economic development, cultural preservation, and environmental conservation. This also has 9 domains which are known as psychological well-being, health, education, use of time, cultural diversity, good governance, community vitality and resilience, ecological diversity, and living standards. The domains represent each of the components of well-being, and the term well-being here refers to fulfilling conditions of a good life as per the values and principles laid down by the concept of gross national happiness. The Gross National Happiness Index that was used by the government of Bhutan highlights a need for taking the non-economic aspects of well-being into account and urges people to take a holistic approach towards the nation's progress. In India, the population of 120 million can be seen as a great human potential. These human resources of our country need to be channelized for proper use, and hence a holistic approach to healthcare is essential. In identifying the human potential, the social case worker needs to play a great role. The case worker should have a thorough understanding of community, assess their needs, identify skills and resources in order to promote the holistic health of the community. He or she can also develop indicators for holistic health with the participation of the community and plan with the people to improve those areas for better performance. Let me sum up. Holistic health can be understood as the overall wellness at all levels of one's being, physical, emotional, mental, and spiritual. Violence, war, epidemics, starvation, and famine are the outcome of the lack of holistic health. It is imperative for us to look at the link between mind, body and spirit of the individuals and families, and to create an environment for holistic well-being of the nation through sustainable and affordable health care. Physical health depends on a number of factors like the immunity level of individuals, genome factors, lifestyle, untoward incidents like disaster and accidents, access to nutrients and healthcare measures of the state. According to the World Health Organization, mental health is defined as a state of well-being in which every individual realizes his or her potentialities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his family and society. Mental health is affected by a number of reasons which include biological, psychological and environmental factors. Poor nutritional intake, disaster or accidents are also reasons for mental illness. The global perspective on mental health has created an impact on the outlook on the rights of mentally ill patients, and therefore the caseworkers can facilitate the changing of perspectives of communities through creation of awareness and help the families identify the illness, refer them for appropriate therapeutic intervention. The social health of a society is important for a nation, and it is based on the relationships within the society and among the nations. The seeds for social health are the values and attitudes nurtured to the families. Therefore, promoting altruistic attitudes and noble values in families reflects the existence of good social health. It is believed that if a person is spiritual, the chances of having evil thoughts are less, and therefore being spiritual is not only advantageous for individuals, but it is also for the society that is being saved from evil and destruction. Social case workers can also explore the gross national happiness concept, which implies the four pillars: good governance, sustainable socio-economic development, cultural preservation and environmental conservation. In India, the population of 120 million can be seen as a great human potential. These human resources of our country need to be channelized for proper use, and hence a holistic approach to healthcare is essential. Let me sign off now and hope to see you in another session. Thank you.